your metacarpals, right? So these are the bones in your hand. This is your first metacarpal, goes down to 5. So here's a Decker veins tendonitis release. And you know, remember, just because, like, look how great you're scarring. Like, your scar looks fantastic. The doctor did an amazing job. You can't even see it. But that doesn't discount what happened under there. You know, so you had the surgery. They had to cut you. They use these little forks and they pull things apart so they can see inside, and they're like cleaning it out. So imagine, there's some shit going on inside. There's scarring. You can't help it. That's what happens after surgery. It doesn't matter how small your incision is or how great it looks from the outside. So the massaging, you know, and the creams and all that stuff, yeah, it's great. It helps the outside. But look at where you're stuck. So if I pull your skin down like that, you see that crease? That's where you're stuck, and you can feel it. I go like that and you can see it. And I can feel it. I don't know if you could see it. Like, so your tendons for the thumb go up and down like this. You can actually go right across it. You feel it? And if you're feeling, remember, just because incision's here doesn't mean just massage right there. You got to go all the way around because there's swelling. You can actually feel a little bit of swelling right here. But you gotta, you know, you gotta massage it. And right under there, okay, that's a bone. You're like, what is that? So hard. That's a bone. And the reason why you feel it so much is because right on top of that bone is a scar. There's scar tissue. So you just feel it. Nothing's wrong with it. That's completely normal to feel. And I want you to know that's completely normal to feel because I need you to massage that. You know, I need you to move it. Now that scar is the same as, you know, this scar, only it's in a different place. But again, just because she had an arthroscopic wrist debridement. So they went in there with their little portals, you know, one with a camera, and the other one's like this, going inside, poking around, seeing what's going on. And they found out that, you know, you just had to clean your wrists out a little bit. So again, if I put your wrists up like this, I'm kind of shortening everything and I'm kind of scrunching up the scar, right? And it feels one way. It feels like, oh, I like that long. Keep massaging me there. Now, if I go in the other way, so bringing your wrist back is more functional. You need your wrist to come back a little bit to get better grip strength, right? Going down, you need that just to, you know, like I was explaining, for women, the most important thing is being able to get to the back of the bra, right? And when you get to the back of your bra, you really, really stretch out your wrist. It's called flexion. So this one normally is easier to get, but it's just more painful. Like there's, when you're bringing your wrist back like this into extension, you feel the stretch and the pull, right? So it's hard, it feels painful, but it has a different sensation. When you bring your wrist down, there's a sharpness to it. It's like pinching you. It's like someone's like, right? So that's normal. It's just whatever you can tolerate. And again, when you put it like this, you're really stretching everything out. So what I'm gonna do is I'm gonna stretch it out. I'm massage. She's making faces. I don't know if you can see it, but she's like, huh? It is a ugly sensation, right? This is like the best way I can say it. Muy sensación feo. Yeah. But I threw a little bit of Spanish in there. So again, we're gonna, you know, go across. Oof. And I was rolling through like a tendon there, and she was like, "What is that?" That's okay. It's perfectly normal. And so this is some of the stuff that you can do at home too. And of course, you're not going to do it as much as we do it because it's hard to hurt yourself. I know. I've been hurting myself for a while with all my ailments as well. But it is hard. That's why you come here so we can help you get to the next level. But if you are able to do some of it at home, it helps us to get to that next level when you come in. Okay? All right.
So
no more of this stuff. We're about to strengthen.
Can I read it?
Yes.